Welcome to the new video MCQs on Bacteriology Part 4. Question number 1. A child develops epiglottitis with thumb sign on X-ray. The capsule of the organism contains PRP, polysialic acid, poly-D-glutamate, hyaluronic acid. The right answer is option A, PRP. Haemophilus influenzae type B has polyribosyl ribitol phosphate, that is PRP capsule, that prevents phagocytosis. This capsule is the basis of Haemophilus influenzae type B vaccine. Question number 2. A 24-year-old develops diarrhea after taking clindamycin. Laboratory detects toxin B. Which test is most specific? Latex agglutination, ELISA, PCR for toxin gene, Gram stain. The right answer is option C, PCR for toxin gene. PCR directly detects the toxin B gene of Clostridium difficile, giving highest sensitivity and specificity. Other tests may miss low toxin levels. Question number 3. An elderly patient develops meningitis. CSF shows gram-negative cocobacilli requiring X and V factors for growth. Identify the organism. Bordetella, Haemophilus influenzae, Brucella, Neisseria meningitidis. The right answer is option B, Haemophilus influenzae. Haemophilus influenzae requires both X factor hemin and V factor NAD for growth. It commonly causes meningitis in unvaccinated children. Question number 4. A hospitalized patient develops pneumonia. Sputum culture shows a gram-negative rod with red pigment on agar. Which organism is responsible? Serratia marcescens, Pseudomonas fluorescens, Proteus mirabilis, Klebsiella pneumoniae. The right answer is option A, Serratia marcescens. Serratia produces a characteristic red pigment called prodigiosin. It is an opportunistic pathogen that causes hospital-acquired infections. Question number 5. A lab worker handling sheep samples develops skin lesions. Gram stain shows gram-positive rods with tumbling motility. What is the organism? Cornybacterium ulcerans, Listeria monocytogenes, Erysipelotrix russeiopathiae, Nocardia. The right answer is option C, Erysipelotrix russeiopathiae. This organism shows tumbling motility and causes erysipeloid in people who handle animals and meat. It is a zoonotic gram-positive rod. Question number 6. A patient develops urethritis with discharge. NAT is positive for an organism lacking peptidoglycan. Identify. Ureaplasma urealyticum, Mycoplasma genitalium, Chlamydia trachomatis, Neisseria gonorrhoeae. The right answer is option B, Mycoplasma genitalium. It lacks a cell wall and therefore lacks peptidoglycan, making beta-lactams ineffective. NAT test is the diagnostic test of choice. Question number 7. A 22-year-old woman develops pyelonephritis. Urine culture shows a motile urease-positive organism causing struvite stones. Identify the organism. E. coli, Klebsiella, Proteus mirabilis, Enterobacter. The right answer is option C, Proteus mirabilis. Proteus splits urea into ammonia, making urine alkaline, thereby promoting struvite stone formation. It is a motile organism known for swarming. Question number 8. A child develops diphtheria-like sore throat, but the organism is urease positive. Identify. Cornybacterium diphtheriae, Erysipelotrix, Arcanobacterium, Cornybacterium ulcerans. The right answer is option D, Cornybacterium ulcerans. Cornybacterium ulcerans produces diphtheria-like toxin but can be distinguished by its urease positivity. Transmission often occurs from animals. Question number 9. A patient with HIV develops chronic diarrhea. Modified acid-fast stain shows oocyst. Identify. Isospora, Cryptosporidium, Cyclospora, giardia. The right answer is option B, Cryptosporidium. Cryptosporidium oocyst stains acid fast and causes chronic diarrhea in immunocompromised patients. It spreads through contaminated water. Question number 10. A surgeon pricks her finger during surgery. The source patient has MRSA. Which antibiotic binds PBP2A? Vancomycin, daptomycin, linezolid, ceftaroline. The right answer is option D, ceftaroline. Ceftaroline is a beta-lactam that uniquely binds PBP2A, overcoming MRSA resistance. It is effective against both MRSA and resistant pneumococci. Question number 11. A patient develops endocarditis after dental procedure. Organism is gram-positive cocci, optochin resistant, bile insoluble. Identify the organism. Streptococcus pneumoniae, Enterococcus fecalis, viridans streptococci, micrococcus. The right answer is option C, viridans streptococci. Viridans streptococci are optochin resistant and bile insoluble, unlike Streptococcus pneumoniae. They commonly cause subacute endocarditis after dental procedures. Question number 12. A patient presents with symptoms after eating reheated rice. Which organism causes this? Staphylococcus aureus, Bacillus cereus emetogenic, Bacillus cereus diarrheal, enterotoxigenic E. coli. The right answer is option B, Bacillus cereus emetogenic. Reheated rice causes preformed cerulide toxin ingestion producing vomiting. This is the classic emetic type of Bacillus cereus food poisoning. Question number 13. A patient with chronic granulomatous disease gets recurrent infections with catalase positive organisms. Which is catalase positive? Streptococcus pyogenes, Streptococcus agalactiae, Staphylococcus aureus, Enterococcus. The right answer is option C, Staphylococcus aureus. Staphylococcus aureus is catalase positive, allowing survival in chronic granulomatous disease patients who lack NADPH oxidase. This makes them prone to recurrent infections with catalase positive organisms. Question number 14. The most common cause of osteomyelitis in sickle cell disease is Salmonella, Staphylococcus aureus, Klebsiella, Proteus. The right answer is option A, Salmonella. Salmonella is the most common cause of osteomyelitis in sickle cell disease. It survives well inside macrophages, leading to bone infections. Question number 15. India ink negativity is seen in Cryptococcus, Histoplasma, Candida, Nocardia. The right answer is option C, Candida. Candida is not detected by India ink, which is used for Cryptococcus. Hence, it shows India ink negativity. Question number 16. Which bacterium in the intestine helps in the synthesis of vitamin K in infants? Escherichia coli, Klebsiella, Staphylococcus, Proteus. The right answer is option A, Escherichia coli. Newborns depend on E. coli in the gut to synthesize vitamin K. This helps in normal coagulation factor activation. Question number 17. Which organism shows a positive CAMP test? Group A Streptococcus, Group B Streptococcus, Enterococcus fecalis, Staphylococcus aureus. The right answer is option B, Group B Streptococcus. Group B Streptococcus, that is Streptococcus agalactiae, shows positive CAM test enhancing Staphylococcus aureus hemolysis. It forms a classic arrowhead hemolysis. Question number 18. A vaginal discharge with fishy odor and clue cells is characteristic of Candida albicans, Trichomonas vaginalis, Gardnerella vaginalis, Ureaplasma urealyticum. The right answer is option C, Gardnerella vaginalis. Gardnerella vaginalis causes bacterial vaginosis with fishy odor. The presence of clue cells confirms the diagnosis. Question number 19. A patient shows a positive wild Felix reaction with Proteus OX19 antigen. Which disease does this indicate? Q fever, scrub typhus, Rocky Mountain spotted fever, epidemic typhus. The right answer is option D, epidemic typhus. OX19 positivity on wild Felix reaction indicates Rickettsia prowazekii, which causes epidemic typhus. It cross-reacts with Proteus OX strains. Question number 20. A bacterium grows on buffered charcoal yeast extract agar. Identify the organism. Legionella pneumophila, Bordetella pertussis, Brucella, Shigella. The right answer is option A, Legionella pneumophila. Legionella grows on BCYE agar, which provides cysteine and iron for growth. It does not grow on routine media. Question number 21. Loeffler's serum slope medium is used for the cultivation of which organism? Mycoplasma pneumoniae, Corynebacterium diphtheriae, Brucella, Bordetella pertussis. The right answer is option B, Corynebacterium diphtheriae. Loeffler's serum slope enhances metachromatic granule formation in Corynebacterium diphtheriae. This helps in rapid identification. Question number 22. The most common cause of urinary tract infection in females is Escherichia coli, Klebsiella pneumoniae, Proteus mirabilis, Enterococcus fecalis. The right answer is option A, Escherichia coli. Escherichia coli is the most common cause of urinary tract infections in females. Its fimbriae allows strong adherence to urinary epithelium. Question number 23. Which Streptococcus species is bacitracin sensitive? Enterococcus fecalis, Streptococcus agalactiae, Streptococcus pyogenes, Streptococcus viridans. The right answer is option C, Streptococcus pyogenes. Streptococcus pyogenes, that is group A Streptococcus, is bacitracin sensitive, used as a screening test. Question number 24. Which gram-positive rod has a terminal spore giving a drumstick appearance? Clostridium perfringens, Clostridium tetani, Clostridium botulinum, Bacillus anthracis. The right answer is option B, Clostridium tetani. Clostridium tetani shows terminal spores giving a drumstick or tennis racket appearance. These spores are highly resistant. Question number 25. Which organism produces pink colonies on McConkey agar? Pseudomonas aeruginosa, Acinetobacter, Klebsiella pneumoniae, Proteus mirabilis. The right answer is option C, Klebsiella pneumoniae. Klebsiella ferments lactose and forms pink mucoid colonies on McConkey agar. Thank you for watching the video. Subscribe to the channel to learn more MCQs on microbiology.